Hello and welcome. In today's session, we'll focus on LO2, understanding the development of social and community welfare provision. We'll explore the key values that guide care and trace how the UK welfare system has evolved from its historical roots to the services we have today. The welfare state in Britain has roots tracing back to medieval times. Early welfare was managed by local churches and parishes. The Elizabethan Poor Law of 1598 marked a significant step, offering protection to the poor. The Industrial Revolution brought challenges, prompting the Poor Law Amendment Act of 1834. These foundations laid the groundwork for future welfare systems. Social policy theories underpin welfare provision. These theories influence how services are delivered. The welfare state aims to alleviate poverty and social exclusion. Industrialized countries often adopt a welfare state model. This ensures basic needs like income, housing, and healthcare are met. Welfare positions are shaped by political ideologies. The right wing favors residual welfare, focusing on individualism. The left wing supports public provision and collectivism. However, these views can overlap and evolve. Understanding these perspectives helps in grasping welfare policy dynamics. Marxists see welfare as a response to class struggles. They view the state as reflecting societal contradictions. Conservatives emphasize social order and tradition. They regard welfare as secondary to structured social relationships. Both perspectives offer insights into welfare's role in society. Liberalism champions individual rights and freedoms. It advocates minimal state interference. The focus is on freedom of worship, speech, and assembly. Liberal policies contributed to early welfare state measures. These policies aimed at preventing destitution and addressing poverty. The NHS was established in 1948. Funded by taxation, it offers free healthcare at the point of use. Initially, doctors opposed it, fearing financial loss. However, it became a cornerstone of UK welfare. NHS evolution reflects changing societal needs and challenges. Community care emerged in the 1950s and 1960s. It focused on integrating mental health patients into society. The 1959 Mental Health Act abolished psychiatric hospital distinctions. This shift was driven by new treatments and social changes. Community care continues to evolve today. In 1984, Sir Roy Griffiths led an inquiry into community care. His report laid the groundwork for the 1990 Community Care Act. The government invested significantly in mental health services. This aimed to improve care delivery and address mental health needs. Griffiths' work remains influential in community care policy. The government's strategy to modernize mental health services included a national framework. It outlined necessary services for mental health care. New initiatives focused on training, supported housing, and crisis teams. The aim was to improve mental well-being and reduce illness burdens. These efforts highlight the ongoing evolution of mental health policy. Several milestones mark the advancement of welfare provision. The Elizabethan Poor Law in 1601 laid early foundations. The NHS Act of 1946 established free healthcare. The Beveridge Report in 1942 proposed comprehensive social insurance. These milestones significantly impacted UK welfare development. Healthcare services have evolved significantly over time. Previously, services were limited and often paid for by individuals. Today, the NHS provides universal access funded by taxation. The range and quality of services have improved. However, challenges like rising costs and health inequalities persist. Despite advancements, the NHS faces ongoing challenges. Rising healthcare costs strain the system. Growing demand and health inequalities need addressing. Technological advancements offer both opportunities and challenges. Balancing these factors is crucial for future welfare provision. The future of welfare provision involves adapting to change. Embracing technology can enhance service delivery. Policies must address health inequalities and rising demands. Collaboration across sectors is essential for sustainable solutions. The welfare state must continue evolving to meet societal needs. The UK's welfare system has undergone significant transformation. From historical roots to modern challenges, it continues to evolve. Understanding its development helps address current and future needs. For any questions or further information, you can reach us on WhatsApp at 0748 436 1688. Thank you for listening, and see you at the next session.